Crouzon syndrome, also known as craniofacial dysostosis type 1, is a rare genetic disorder that significantly affects craniofacial skeletal development, which it leads to a wide range of manifestations in the head and neck region. This condition arises from the premature fusion of cranial sutures, particularly the coronal and sagittal sutures, typically occurring within the first year of life. The resulting craniosynostosis restricts normal growth of the skull and facial bones, causing progressive and often severe craniofacial anomalies. Present at birth and worsening over time, Crouzon syndrome is characterized by distinctive clinical features including hypertelorism, exophthalmia, external strabismus, a parabeak nose, short upper lip, hypoplastic maxilla, and mandibular prognathism, which contributes to the overall appearance of midfacial hypoplasia. Oral and intraoral manifestations are frequent and diverse. These include oligodontia, peg-shaped teeth, widely spaced dentition, macrodontia, cleft lip and/or cleft palate, and a V-shaped maxillary dental arch. Overcrowding of the maxillary teeth and occasional upper airway obstruction due to midfacial underdevelopment are common and often contribute to respiratory impairment. The genetic basis of Crouzon syndrome originates from a missense mutation of the FGFR2 gene, which is the fibroblast growth factor receptor 2, which plays a pivotal role in cranial suture development. This condition follows an autosomal dominant inheritance pattern with 100% penetrance and a wide phenotypic variability. There is no known race or sex predilection, and the incidence is estimated at 1 in every 25,000 live births worldwide. When one parent is affected, there is a 50% chance of transmission, regardless of the offspring's sex. The early fusion of cranial sutures in Crouzon syndrome disrupts normal craniofacial growth, which in turn affects oral health, function, and aesthetics. This syndrome often results in significant challenges in mastication, speech, and breathing, necessitating early and continuous dental, orthodontic, and surgical interventions. Because many of the syndrome's features are visible in the oral cavity, dentists and orthodontists play a crucial role in early diagnosis and management, which can help in planning timely and effective interdisciplinary care. The objective of this review was to synthesize current literature on the oral manifestations of Crouzon syndrome, to enhance understanding among dental and medical professionals, and to highlight implications for diagnosis, treatment planning, and interdisciplinary care. The hypothesis proposes that while both interceptive and comprehensive orthodontic modalities were used, early multidisciplinary intervention results in more favorable long-term craniofacial and functional outcomes rather than delayed or isolated orthodontic treatment. The methods in the study included a literature search using databases like PubMed, ScienceDirect, Scopus, and Google Scholar. The keywords that I used were Crouzon syndrome, orthodontic treatment, interceptive orthodontics, comprehensive orthodontics, multidisciplinary treatment, and functional outcomes. The inclusion criteria was orthodontic or craniofacial treatment strategies, interceptive or comprehensive treatments, outcomes relevant to craniofacial morphology or function, and the exclusion criteria were studies focused solely on non-orthodontic management. The data analysis extracted demographics, treatment type, and timing, interdisciplinary team involvement, treatment duration, and outcomes. It compared early multidisciplinary versus delayed or single discipline approaches, and identified patterns in findings, research gaps, and clinical trends. My results, I found craniofacial and dental findings, which included midfacial hypoplasia, maxillary deficiency, mandibular prognathism, crossbite, crowding, and V-shaped arches. Dental anomalies that were found were delayed eruption, hypodontia, abnormal morphology, and functional issues that were seen were with mastication, speech, airway. Meta-analyses showed decreases in midfacial depth and maxillary length, and orthodontic treatment modalities included early interceptive care using expansion, face masks, and functional appliances, which in turn improved occlusion, dental alignment, and facial balance, as well as airway. Another modality was adolescent or adult comprehensive treatment, which often involved surgical Lefort 3 bimaxillary distraction osteogenesis surgeries, as well as another result was pre-surgical orthodontics leading to better post-operative occlusal and skeletal outcomes. Another result was the timing of the intervention, showing that early treatment led to favorable craniofacial growth and reduced skeletal discrepancies, while delayed treatment led to more extensive surgical correction. About 25 to 35% of improvement was seen in midfacial projection and occlusion with early interdisciplinary treatment. Multidisciplinary management. The team would include orthodontists, craniofacial surgeons, pediatric dentists, ENT specialists, and speech therapists. Coordinated care led to improved airway, speech, and occlusion. Interdisciplinary care was consistently superior to isolated treatment. In terms of future direction for this study, future research can evaluate long-term craniofacial stability, occlusion, airway function, and quality of life following early interceptive orthodontic treatment. Additionally, efforts should focus on optimal treatment timing, sequencing, and the selection of interceptive versus comprehensive orthodontic interventions to improve outcomes in the management of Crouzon syndrome. So to conclude, Crouzon syndrome is associated with significant craniofacial, dental, and functional abnormalities affecting growth, occlusion, and airway health. The literature supports early multidisciplinary interceptive orthodontic intervention, which is associated with improved craniofacial development, better functional outcomes, and reduced severity of skeletal discrepancies. In contrast, delayed or isolated treatment more often requires more complex surgical intervention. These findings emphasize the importance of timely diagnosis and coordinated interdisciplinary care to optimize long-term outcomes in patients with Crouzon syndrome.